In the UK, the NHS experiences a yearly peak of hospital admissions for asthma in September, when the weather cools down, which continues into the early winter months. While on its own, cold weather does trigger asthma, the average exterior temperatures in the UK does not correlate with hospital admissions. The age range of people being admitted in hospitals also reveals that 40% of patients are children, showing a link with families returning to the indoor classroom environment. This asthma peak has also been observed in Canada, the USA, Mexico, Israel, and in the Southern Hemisphere when children return to school in February instead of September. It is logical to assume that the cold weather is not the sole factor, but instead the decline in air quality due to people spending more time indoors and windows being kept closed could be the cause of this yearly peak. Further research is required to rule out other potential triggers. In order to understand the burden of asthma, it is important to understand not only the emergency hospital admissions due to the illness, but also the financial burden of the illness. In 2015, there were 71,000 hospital admissions for asthma, and as of 2018, there are 5.4 million people with asthma in the UK. This cost the UK approximately £1.1 billion to treat annually, with patients requiring over 50,000 days of hospital bed usage. The cost of treatment is expected to rise, with estimates predicting it will double by 2032.
Public Health England have reported that it could cost £5.3 billion by 2035 for health and social care issues.
Well, the prediction is that unless this issue is addressed properly, then the symptoms of asthma and other diseases will increase, and obviously that will have a direct impact on people's health and the treatments in hospitals and so on. So the impact on the NHS will probably exceed the cost of making buildings and homes properly ventilated.
Death rates are around 1,000 to 1,200 people per year. That is 3 people a day within the UK alone. Overall, this is extremely low. However, in the context that 90% of deaths from asthma are preventable, it is much higher than it should be.